Our next speaker is Reggie Moore. Reggie Moore serves as the Director of Community Safety Policy and Engagement for the Comprehensive Injury Center at the Medical College of Wisconsin. He leads their efforts in violence prevention, advocacy engagement, and capacity building in Wisconsin and throughout the country. The title of his talk is going to be Equitable Injury Prevention. Mr. Moore.
About to say, it's a tough crowd. I know it's early in the morning. How many of you got out last night, by a show of hands? Don't lie, it's okay. No judgment. All right, cool. Good to see so many people here up bright and early, and thank you all for putting on this conference and for being here. Again, my name is Reggie Moore. I direct the Division of Community Safety, Policy, and Engagement with the Comprehensive Injury Center, led by our leader here, Dr. Terry Derone-Cassini. And I also want to shout out some of my other colleagues from both Freighter and the Medical College of Wisconsin who have been, even during my time as the director of the City of Milwaukee's Office of Violence Prevention, have been extremely committed to addressing gun violence in particular as a public health issue, and have been great partners. In my brief talk, I think I'm having the same issue, so I'm clicking the arrow. So in terms of the Division of Community Safety, we work to increase the capacity of local, state, and national efforts to promote safe and healthy communities. So I've been working with several cities around the country who are committed to either developing comprehensive public health-driven community safety plans or establishing offices of violence prevention or community safety, and really actualizing what does it mean to reimagine public safety. I know that was a term coined, particularly after the protests for racial justice and equity around the country in 2020, and many communities and jurisdictions were really looking at what does it mean to produce public safety beyond law enforcement. Also, I want to encourage you to click on some of the, or scan the QR codes. It'll take you to pertinent information, so that'll take you to the CIC's website. I like to highlight the definition, particularly from the World Health Organization, and it's a definition that I think is the most comprehensive definition of violence. Often when we think about violence, we think about the physical impact that violence has, but understanding that violence can be threatened or actual against oneself, another person, a group, or community. And particularly, I want to underscore the group or community because oftentimes we don't think about the impact that violence has or the production of trauma, not just on individuals, but entire populations of folks. And so, given that I'm preaching to the preachers here, I won't belabor this, but I think many of you understand the impact, the varying impacts of violence that has both physically or risk behaviors on child and maternal health, and the psychological and emotional impacts that violence has. And so understanding the urgency of addressing this as a public health issue really can't be underscored enough. And so what I really want to talk about in terms of equity and the approach to equity, many communities are looking at addressing and building ecosystems to address violence. And understanding that one office, one program, or one sector can't do it alone. And so I think this particular quote really underscores what does it mean to understand that everything that happens in our society, in our community, has an impact on all of us. And in some communities, there's this perception that gun violence only happens in a particular neighborhood or particular area of the city. And obviously, since COVID, we have seen gun violence, when you look at maps, really expanding beyond particular areas. Although those areas continue to be overburdened in terms of gun violence, we're also seeing it well beyond particular areas and neighborhoods. And so we can't look at these issues in isolation. So 6 elements that I wanted to highlight, if I can go back, 6 elements I wanted to highlight in terms of building an effective community safety ecosystem, the importance of having community champions, having a shared analysis and vision of the problem, what's happening in the communities that we would like to see, multi-sector partnerships, including policymakers, philanthropy, healthcare professionals, young people, those who've been directly impacted being a part of this process, sustainable investment, coordinated interventions, and shared accountability. And so I'm going to give you a local example in Milwaukee in an effort that we undertook from 2016 to 2017, engaging thousands of community residents and developing what we call the Blueprint for Peace. And several communities around the country are also building their own plans using this as a platform. And this is just a vision of the Blueprint. Again, you can scan the QR code to actually view the Blueprint online. And the vision is that Milwaukee is a safe and resilient city where the lives of all residents are valued, protected, promoted and protected. And the Blueprint consists of 6 goals and 30 strategies, again, that were prioritized by the community. So after I walk you through the example of the Blueprint, I will leave you with very concrete sort of imperatives as you look to incorporate and pursue equity in the efforts that you're doing, both within hospitals and outside of them. And so with the Blueprint, one of the first things that we did was really partnered and worked with the community to identify the core risk and protective factors that they felt were critical to, number one, exacerbating violence. And these are some of the structural issues. So in terms of the history of segregation and policies that have been implemented in the city that have created conditions for violence to occur and contributed to the disparities that we see both around education, economic, mass incarceration, et cetera. And then the protective or resilience factors are structural things that the community prioritizes to say these are the things that can actually produce and promote safety. And so all of the strategies in the Blueprint are aligned to address either the risk factors or the protective factors. So these are the values that and the principles that the Blueprint were built on, and the 4 were community, equity, action, and community resilience. And so community being the first one is really that this plan had to be driven by the community and that the voice of the community had to be centered in that process. Equity, understanding that different forms of violence impact different communities differently. So when we look at gun violence, understanding in terms of particularly Black and Latino males being disproportionately impacted by gun violence, being a part of the process and the solutions. Understanding when we talk about domestic violence and sexual assault, that young women and girls also being disproportionately impacted by that. So not ignoring the populations and communities that may experience different forms of violence differently, but also not ignoring the interconnectedness of violence. Looking at individual and community resilience, one of the things that I tend to highlight or underscore is that we have a lot of data about what's dying, broken, and bleeding. We don't have consistent and reliable data oftentimes about what's working. And so I love that suggestion earlier around being able to tell your stories about the amazing work that you're doing and the impact that that's having. Because if that story goes untold, it can be extremely defeating in terms of believing that the efforts that are happening are not making an impact, and that the communities that we are working with and partnering with are not broken. They've been intentionally deprived and neglected, and in some cases attacked. And so understanding that there's also people working every day and there's assets in neighborhoods and communities that are doing life-saving and life-changing work. And then finally, action, that this Blueprint isn't worth the paper that it's written on or the website that you're viewing if it's not being implemented. And so these were the principles or values that the Blueprint were built on. Really quick, and for the sake of time, I may go quickly, so just I apologize for my speed. This is the ACER framework developed by the Prevention Institute. It's the Adverse Communities, Experiences, and Resilience framework. You may have heard of ACEs in terms of when it comes to children and trauma. This framework looks at the intersection of people, place, and opportunity, and again, underscoring that violence and trauma can also be impacted or inflicted on entire communities, and that the solutions and strategies around that have to take all 3 of those things into account in terms of the interventions, the policies, the investment, in order to uplift the resilience factors that were highlighted earlier. So again, the Blueprint was also built on that framework. Forward for Life is our violence intervention program that has a community component that includes street outreach, violence interruption, but also a hospital response component. So I know many here are familiar with HVIPs, which was mentioned in the previous presentation, where we have hospital responders who are responding to gunshot victims in our Level 1 Trauma Center, but also expanding to other hospitals throughout the city. All right. So jumping to, as I mentioned, in terms of really concrete and core examples of advancing equity. So, and this is adopted from the educational gun violence. Sorry, it's at the bottom, and unfortunately, it's cut off at the bottom. I don't know if you can read it from the back. If not, I just wanted to at least cite or give credit to that organization, which is also connected to the Bloomberg School of Public Health as well. But this particular, these suggestions came from a document to really look at how do you not exacerbate disparities, and particularly racial disparities when it comes to gun violence. Because in many communities, people may say, well, we just need more police, or we need to lock up more people as a result of gun violence, not understanding that if that was the solution, we would have the lowest gun violence rate in the world. And so understanding that we shouldn't have solutions that essentially will perpetuate disparities. So in this first one, identify and engage a diverse cross-section of community members and routinely asking who's missing and inviting them to the room. So it's oftentimes you may find yourself or be in a room where it's very clear that the population being talked about is not represented in the room. And it's really important that people are asking the question, who's missing and why, and how do we ensure that they are a part of this process? I don't know if I'm supposed to point this in a particular. Or can you all click from back there? Okay, cool. So this next one is identify common interests and allow for all members to provide ongoing input in developing and share vision and goals. So again, how critically important it is to center the voices of those most impacted in the solution and establish consensus building and conflict resolution mechanisms. I can't underscore that in the process of even developing the blueprint, how system leaders in some cases felt threatened by the solutions. An example of that is you may have people who represent the criminal justice system where the community is saying, well, you know, system or state violence, i.e. police violence, is a form of gun violence, where you may have people threatened by that or feel like, well, they don't want to be a part of any document that acknowledges that. And so it's really important from the very outset to understand how do we keep people in the room and how do we challenge people to understand that this issue is bigger than one individual in a system. And having worked in city government, understanding the harm that government can cause, even when you have good people working in that system. And I think in the first presentation, it was underscored. In some cases, you have to wait for people to retire. And in other cases, you just have to stay the course and really try to shift in terms of paradigms and how people view the work that they're doing. Next slide. So let me go back. Establish roles and responsibilities to share and build power within communities. I really want to underscore the second bullet point in terms of authentic relationships that disrupt the historically transactional nature of movement based on specific policy and research efforts, meaning that oftentimes we're doing work into communities as opposed to with communities, and how important it is to not just extract information or extract data, but to really say, how do we build power? And when we talk about community-based research or any types of programs or interventions that we're doing in partnership with community, that we're leaving skills, resources, investments, and ongoing partnership beyond whatever that initial or a specific area or body of research or program activity was. And so that's critically important, especially understanding that we often represent very well-resourced institutions and organizations that building that power is critically important. Commit to personal and collective growth and healing, acknowledging the historic trauma that has happened, and also the present harm that continues to happen, and being open and honest about that and understanding that that has an impact on what's happening, not just in your healthcare institutions and the patients that you serve, but in the community as a whole. And promote strategies in communities that are most disproportionately impacted. Oftentimes we talk about it, we understand that yes, gun violence has expanded and is impacting more communities and populations, but also understanding that there are communities that historically and presently are experiencing the greatest burden of gun violence on a daily basis. And if you've had the chance to even tune into the news in Chicago over the 2 days that you've been here, I think it underscores the urgency and the ongoing impact that we see in terms of gun violence every day, unfortunately. Identify stakeholders, their resources and influences more effectively reach key policy and decision makers. So again, understanding that the boards of our institutions or healthcare systems, the trustees, all of the other organizations that you may be a part of, how do you leverage those relationships to support and advance the work that not only that you're doing in the hospitals, but also the work that's happening in the community. Engage in ongoing evaluation that is inclusive of all members. So again, understanding that data isn't just in terms of numbers, but it's also the input from the community, and valuing those experiences and perspectives, and making equitable collaboration sustainable. So again, focusing on building social capital and power, particularly when succession planning is happening. And sometimes we don't have control over that succession planning, like when there's a shift in a mayor or another leader that has significant influence over the resources, support, or investment in the work that's happening. And then what I want to underscore, on the last 3 slides, this one in particular, celebrating the victories and acknowledge the inevitable setbacks. And so gun violence prevention requires sustained advocacy and will come with setbacks, but that joy and celebration should be normalized in this work. And I really want, in speaking to all of you, underscore that work in terms of what you see every day in the work that you do and the lives that you save, and understanding how important it is that you take care of yourselves as you do this work. And there's a quote down here from Audre Lorde that caring for myself is not an act of self-indulgence, but an act of self-preservation that is also an act of political warfare. And I didn't realize that this quote actually came after her second diagnosis of cancer. And so understanding that as a freedom fighter, as an intellectual, as an advocate, that she recognized the importance of that care. And so again, at the end of the day, I think all of this work is leading towards building a system of community safety and violence prevention in this country that, again, is beyond the criminal legal system, and understanding from a public health perspective, from a healthcare perspective, that every institution in our communities has a role to play in producing safe and healthy communities. And this is a QR code for my contact information, and I thank you all very much.